All right, up first today, the American Diabetes Association has designated tomorrow as an alert day. It's to raise awareness about type 2 diabetes, and it's a reminder to take a diabetes risk test and take control of your health.
And here to explain the importance of understanding and reducing your risk is certified clinical nutritionist and pharmacist James LaValle. Thanks so much for coming in.
Great to be here. Thank you for having me.
So is diabetes type 2 becoming an epidemic in this country?
It really is. You know, 10% of the U.S. population currently are diabetic, with an expected 40% of the U.S. population predicted in the near future. That's pretty scary. You know, that's Center for Disease Control information. So we're tracking this, and it's a real problem.
So how does that compare? Give us that. What does that number mean, like, say, from 10 years ago or 20 years ago?
Well, I mean, it's growing so exponentially, it's difficult to say, but one way might be is to think of, in 1997, only 5% of all newly diagnosed diabetic children were type 2 diabetics, meaning diet and lifestyle. 10 years later, 40% of all newly diagnosed children with type diabetes were type 2 diabetics.
Wow. What's the difference between type 1 and type 2?
Type 2 is mainly lifestyle, meaning diet and exercise can help, but we're finding out that things like stress, eating too many carbohydrates, brought a couple examples of what a serving of carbohydrate are, that can be a big deal. Not getting enough sleep actually can influence your risk of type 2 diabetes and becoming overweight.
Wow. So why is diabetes related to weight?
Well, once your blood sugar starts to go up, actually it kind of triggers your body to store more fat. You're not using those calories, so that in a sense it's helping you for the famine time that it anticipates that you're going to have. And so that's what happens, is that when you're taking a lot of insulin, you're pushing a lot of insulin out because you have more blood sugar, that causes you to store fat.
So our bodies are preparing for the lean winter months ahead, when there's going to be a scarcity of food back in the hunter-gatherer days. Well, but yet we're never in that famine.
We have coffee shops now we go in. We can get a pastry, or we can get something. A lot of people don't realize there's things you can do. So, a great strategy is, I use for my patients, I use an enzyme that's from white bean extract called phase 2. The reason I use that, it helps to reduce, that actually comes from this, and that actually helps to reduce the amount of glycemic burden of food by about 60% for my insulin-resistant population, even my type 2 diabetics. It helps me to get that spike in their blood sugar down. Why is that important? When your blood sugar goes up after a meal, it's the most plaquing event on your arteries, and people don't realize that. That's why we need to watch our carbohydrate intake, learn how to count carbs.
Wow. All right, so how we eat plays a role in this, but is family history a factor as well?
Oh, family history without a doubt. My grandmother was a fingerless, blind, type 1 diabetic. My father was a person with diabetes, as were all of his brothers. Our ethnicity, Italian. There is a predisposition, but the reality is learning how to count carbs. Got to give you one example of this. This is a serving of granola.
That's a serving?
That's a serving. How many?
What is that, 2 tablespoons?
Yeah, how many people do you think eat that much, or even double that, for their breakfast granola bowl, right?
I would say 4 times that much. Yeah. Wouldn't you, Kelly?
Oh,
minimum?
Yeah,
at least.
I mean, you have a bowl. You want to fill up your bowl.
Fill the bowl up, right?
How many? That looks like 2 tablespoons.
That's about, it's 15 grams. It's about 2 tablespoons. That's all it is. This is a serving of rice. Remember what happens when you go get Chinese? How many people eat out of that? Right. I brought these on purpose. I think people don't realize how many carbohydrates they have. I actually developed a carb counter that people can download from our website if they want. It really can be helpful. And then, of course, we could do a quick check if we'd like.
Now, you say the blood tells everything. All you have to do is get a little. So you're going to do the prick
We're going to do it right now. We're going live.
That did not hurt,
by
the way.
Done.
Okay.
Well, but then.
So this is what a diabetic would do.
Your finger didn't hurt because we got to push you a little harder.
Oh no.
Oh, it won't be that bad.
You asked for it, Cal.
This is what you do. Look, even if there we go.
She's a brave girl.
Okay,
brave girl.
Thank you.
Feeling all right there?
You made it. Oh my gosh.
Okay. So what do you do with your blood there?
All we're going to do is put it right on here.
And what do you have in your hand there?
This
a blood reader.
This is what a person with diabetes or insulin resistance would use to check their blood sugar. You have an 84 blood sugar, and you're already up in through the day. This is fantastic. This is what you're looking for. You just aced the test. Here's the thing a lot of people don't realize. For every point over 84, when you're fasting in the morning, it represents a 6% risk of being a person with diabetes the next decade. So if you get a blood test and you're in the high normals, like 92, 94, which is considered normal, you could be running a 60% risk of becoming a person with diabetes in the next
Well, how
decade.
could that be considered normal then?
Well, it's because it's risk still. So it's still within normal range, but you haven't developed the disease yet. What we're finding out about blood is that when you look at blood tests, you can look at trends to find out, am I heading towards heart disease? Am I heading towards diabetes? That's what this week is really about, getting people to get engaged and learn earlier about their blood sugar.
So that number tells you what about what I'm consuming, what I'm doing?
That number, right, when you see your number, it tells you, first of all, not just what you're consuming, but how your body's handling it. Both of us could eat a cookie, but if I'm insulin resistant and you're not, you may handle that sugar from that cookie. I might make too much insulin, and then I either can't get the blood sugar out of my bloodstream, or I take it out too fast.
So my pancreas is handling it well?
It's about your pancreas responding to that blood sugar load, and then releasing insulin or releasing another hormone called glucagon, either one of those, to help balance out. It's really important to realize the higher your blood sugar, the more your risk for things like kidney disease. So we see all these dialysis centers, so kidney disease, non-traumatic amputation, non-traumatic blindness. All diabetics have heart disease. And remember, the top thing that plaques your arteries, post-meal high blood sugars.
Wow. All right, you have an online assessment that people can take. Very simple test. Just go on there, and what is it? Maybe like 5 or 6 questions.
Yeah, simple.
And this is on the Diabetes Association website where people can go.
Yeah, people can go to the Diabetes Association website. If they want the carb counter that we put together, they could go to my website. We put one together to help consumers because we teach so many doctors as well as consumers during the course of the year that we thought it was important to give them a quick handout.
And this is a good point to bring up because these are the issues you need to be discussing with your doctor when you go for your annual visit. And maybe it wouldn't come up if you didn't start the conversation.
Absolutely, and you will be alarmed at even how many healthcare professionals don't know their blood sugars, because when I get up in front of hundreds of people at a time and lecture, I ask to raise hands, and a lot of times we're ignoring this because if we're not overweight yet, we think we don't have the problem. And it's you're trending towards that problem, and you want to make sure you get a hold of it before it does become an issue, because with higher blood sugar comes obesity.
All right, so much to keep in mind. Very good information. Thanks so much. James LaValle, he is a clinical pharmacist and a board-certified nutritionist and the author of Your Blood Never Lies. Thanks for coming in today.
Thanks for having me.
And we've got lots more Let's Talk Live ahead, so stay with us. We are going to continue to live tweet throughout our program.
As we always do, and we also post some great behind-the-scenes photos for you. We'll be right back.